Welcome everyone. I have many questions in my life and in studies, and therefore I could say the best way to this is rational pharmacotherapy to approach it. For this, and why I've chosen this, because my vision is education patients in the world. Because, you know, patients have to contribute to their medication as well. Therefore, my core vision is, my core mission is to be a core character in internationally recognized patient education programs. And how do I want to approach this? I think as rational pharmacotherapy has many aspects, but the best way, I think, is maybe questioning whether we have to give a drug or we do not give a drug. And therefore, I wanted to ask whether we have to give, for example, nabiximols to patients with spasticity associated with multiple sclerosis. Why it is a question? Because about 2.8 million people suffer from multiple sclerosis, and from them, 84% have spasticity, which is a really great number. But from these patients, about 1/3 of them do not have enough answer to their current antispastic therapy. But here's a trending theme, hemp, and we know that from hemp can be achieved nabiximols, which seems to be a great drug. But there's no really good information about them from recent data. So my clinical question is, do nabiximols improve the symptoms of multiple sclerosis-associated spasticity? And if my hypothesis is true, then we can say that nabiximols should be given to these patients where the standard antispastic therapy was not working well. If first my hypothesis is true, and secondary, the recent observational studies are true, then we can achieve about 40% of decreasement in the antispastic problem of these patients, which is a great number if you see it as starting from 6 in a 0 to 10 numerical scale and achieving lower than 4 in this scale, which 4 is the cut point of mild and moderate spasticity. And where am I? I've searched in 5 databases with the latter mentioned search key. And now we achieved 14 articles that can be used in our study. And we already started the extraction of data. My second question is whether we have to give a drug and whether we do not give drugs. And in this questioning theme, I think one of the greatest population and one of the most problematic population is lactating women. Why? Because pharmacotherapy of lactating women is really problematic in many aspects. Just for example, medicine may pose danger to the baby, and also they may decrease the breast milk itself, which is not nice. But on the other hand, undue rejection of medicines is also harmful for the mother and therefore the baby too. So, this is one point. The others are just, everywhere we can find over-the-counter drugs. But we also know that they can really be easily achieved. And in, for example, online achieving them, there's really, really low medical supervision. And the internet is a great problem in this case also, because the proper information on the internet is questionable in one case. And on the other hand, we know that if we start something like a patient education problem, we do not really know how we should do this. And I think in this case, we have to ask whether which medium should we use. So, our aims are twofold. First, to develop a guide for self-medication of pregnant women. Second, to assess which medium we should use, which tool we have to use in these cases. So, the clinical question is, what is the most effective medium to educate lactating women on the use of over-the-counter drugs? You can see the four core intervention, what we want to use, and as after the study, we may have answer which type of tool we should use. And in this case, we can decrease the confusion about over-the-counter drugs in lactating women. And we can give them rational and safe answers, what they should use. And, in these cases, in this period of life of the woman is really, really frustrated by many questions. And in at least one team, we can give them answers. Where we are now, we are in the drafting period. We want to work with adult lactating women. Intervention itself would be the four mentioned video, article, podcast, infographic, so the aforementioned medium itself. And the outcome would be the knowledge transfer, which can be measured by tests, for example. So now, after my work, I could have answer whether we should use, for example, nabiximols in multiple sclerosis, and we may have answer how to teach lactating women. So, after all, I think we can have great answers about rational pharmacotherapy. And as you know, after all, I had many mistakes and many things go wrong in my PhD work and my life. Therefore, I realized that never ask God what else could happen. Always think positive, find a way out of the problem, and do as you can. Thank you for your attention.
It's not a real question, it's just a remark. So since I'm a clinician, I know how important patient education is. So I have to talk a lot with the patients, and believe me, all the patients look for the internet first. We have conducted a research 4 years ago. We published in Orvosi Hetilap, and like 99% of the patients look first on the internet. And I also have some experience in internet-based education, since I'm writing a blog for 12 years and also doing podcasts and educational videos as well. And that's why I say it's very, very important what you do. But it will be not so easy, because you need different equipments, for example, to produce the high-quality podcast, because I can write a blog post in my phone if I'm bored here. Of course, I'm not. But if you would like to create a good quality video, you need nearly a complete studio. And it has some other aspects, like it affects who is speaking, how is speaking, so I don't know whether you plan to say the same text on the infograph will the speaker say the same text on the podcast or the video? So you have to take care because it's not easy to compare, but it's very, very important. It would be very important.
Really, thank you for the comment. Also, I have to mention that, we also think about how to make it comparable and measurable. And I think this is a great opportunity to advertise that we may need specialists in the theme. We've already talked with infograph specialists, but I think this is not a one-person job. So if anyone has further ideas, I would really appreciate it.
Yes, congratulations. Actually, I have a question regarding your first study because we already talked about your second study a couple of times. I have just a methodological question regarding the treatment options. So this will be a simple comparison between nabiximols and placebos, but are there any network analysis regarding questions? So is this really the most important question that you can raise, or methodology that you can raise in this topic?
I think in this case, we do not really see how to treat spasticity. As I mentioned before, that about 1/3 of patients does not answer really well to antispastic therapies. And therefore, in these cases, they mostly tried at least one, but in many cases, two antispastic agents, therapies, protocols. So in this case, I do not really see that they really tried they really tried to measure and compare all the agents. Therefore, I think the add-on question was a bit more trending and more questionable in this case. But I have to say that you're right that we may have to do network analysis about what agent should be used. And after this, I also would ask again that what agent is the best to give together with nabiximols.
Thank you. Just a last comment, and I don't know if Janner is having a question. I really advise for you to, when you are doing the basic characteristic table of this study, to include also the ongoing treatment, the interferon treatment or any kind of treatment that the patient is receiving also, because that can influence your results pretty much. Thank you.
Naturally.
This will be the last. So you're in your second PICO. I mean, this sounds simple but very difficult, because what is the control?
The control would be a before questionnaire.
But before the questionnaire, I mean, they already went up to the web and then discussed it on the. So this, I think, this is very difficult. I mean, so probably you could do this, but you need actually professional advice. I would say that from the, I mean, just not alone. I mean, planning that not alone, because of the mixture of information and disinformation too, which is in these questions, is actually a big point. So I mean, just to cut that off, this could be very difficult, I think.
Thank you really for the question and then the comment. Yes, the comparison itself would be the before treatment, and we would compare it to the after treatment cases. This would be the protocol or steps in our case.